The Nigerian Association of Resident Doctors has raised the alarm over the country's poor doctor-to-patient ratio of 1 doctor to 19,083, describing it as far from global best practices. In a statement to mark Nigeria's 65th independence anniversary, the association's president, Dr. Mohammed Suleiman, announced that effective from October 1, resident doctors nationwide will no longer take continuous calls exceeding 24 hours. Nigeria continues to grapple with severe shortage of doctors, a crisis deepened by the steady migration of health professionals in search of better pay and working conditions abroad. Right, for more on doctors' lamentation on patient-doctor ratio, which is set to limit the number of hours for members, we're joined now by Dr. Mohammed Suleiman. He's the President, National Association of Resident Doctors. Thank you very much for joining us.
Good evening,
on Newsnight. So, effective October 1, doctors will be limited to 24 hours call.
Yes.
Has that been effected? What are we seeing so far? Why has this really become a necessary move?
Thank you very much. If you look at the statistics, in the last 10 years, we have lost close to 15 to 16,000 doctors from this country to other countries. 15 years ago, about 10 years ago, the federal government, due to one of our actions, sacked about 10,000 doctors, 15,000 doctors when we were on strike. But they brought all of us back.
Okay.
That was 10 years ago, in 2014, thereabout. This year, the National Postgraduate Medical College of Nigeria, in one of the workshops we've had with them that we invited the registrar, the current number of resident doctors at the federal level training in different tertiary institutions in Nigeria stands just above 8,000. So that is a drop in about 10 years from 15,000 to about 8,000.
Wow.
When you look at Nigeria's population, the best case scenarios will tell you 240 million currently in Nigeria's population. And there are even models that predict that we are closer to 300 million than we are to 240 million. Now, if you do the math and add in resident doctors that are coming from state institutions, you find out that there will just be around 11,000 resident doctors in the entire country to cater for that population. So what you have, because we are trained to have empathy, that empathy has transformed over time to become sympathy, to become pity for patients. And then that has created an entitlement kind of work environment that you must be around to do that work. What that has resulted to today is that you see a doctor taking 22, 25, 30 days call in a month. For instance, a call roster just came out of FTH Lokoja today. Dr. Victor Audu and Dr. Yomi, if you see them on the call roster, you see that Dr. Yomi is taking 22 calls in this October. Dr. Victor Audu is taking 22 calls, Yomi is taking 31 calls. Is it really feasible that you would want to see Dr. Yomi or Dr. Victor Audu as your attending physician when you go to that hospital, and that unit in particular? They are burnt out, they are tired, their mental health is there, they have their own health challenges. If you work for 1 month straight, chances are that you will not be at your best.
Right.
Now, the annual general meeting last week in Katsina looked at this situation and said, in addition to many other issues, and said, no, enough is enough. I mean, doctors are not slaves. This is the reason why doctors leave this country. The burnout is real, excess workload is real. These conversations have been going on for quite some time. And unfortunately, the federal government has not really matched the conversations with actions. In fact, in addition to this 1st October directive we have given to our members all across the country, there are other issues. For instance, medical officers who have been promoted from one grade level to the other for the last 5 years have not been paid their promotion arrears. For instance, in 2023, there was an adjustment to the Commerce table that pays doctors. There's still a 5 months arrears on that table from 2 years ago that has not been paid by federal government. If you look at an allowance that was introduced between 2014 and 2024 and 2025, called the accoutrement allowance, about 6 months worth of that allowance has not been paid. 6 months ending of last year, ending of 2024, has not been paid by the federal government. If you look at house officers, they are the youngest in the profession, being trained to take over the responsibilities from some of us that are nearer the end than the beginning. For about 5 years now, we don't know what table the federal government is using to pay house officers. We have no idea what is imputed in their salary scale. There are no pay slips to show what these house officers are entitled to. We suspect that there are allowances and arrears that will accrue as far back as 5 years from now. Some of these house officers have finished, some of them have even left the country. And unfortunately, the Medical and Dental Council of Nigeria and the Accountant General's office is dilly-dallying who gets to give out this pay slip, so that we'll look at what is happening. At the end of the AGM last week in Katana, the association said enough is enough. For these issues I've mentioned, 30 days ultimatum to the federal government. For the issue of excess workload and burnout, we have to limit the calls we can take to just 24 hours. And then let the conversation continue with the federal government from that end. If I work for if I take a call for 24 hours, I should have time to rest before I take another 24-hour call. Rather than being on 24-hour calls for the entire month. I can show you the call rosters, I can show you resignation letters.
I have many questions from what you have just said, but let me just limit it to as little as I can. What would be ideal for Dr. Yemi and Dr. Audu that you have mentioned in the roster, given the circumstance that we are? But when you say you give 30 days ultimatum, but you also said you will begin 1st of October, did the ultimatum begin 1st of October, or you have reduced your working hours already? And what are the immediate steps that the government has to take? Because you've just told us now that those that you are training, those that Nigeria is training at the moment, have reduced to 8,000 nationwide. So is it a question of employing, and where are we going to employ from?
Well, first of all, for Dr. Victor Audu and Dr. Yomi in the orthopedics department of FTH Lokoja, I would honestly suggest to that hospital to close down that department. If they don't have manpower to man it, I think they should merge with other units and share responsibilities. You don't expect 2 individuals to serve as first on call for an entire month in an orthopedics department of a federal teaching hospital. It's not a general hospital, it's a teaching hospital. I mean, we are putting the lives of Nigerians at risk. I think that will be the quick fix for what Yomi and Victor Audu are going through in FTH Lokoja. Going on to the issue of the ultimatum. The ultimatum started counting from the day we had our press conference, which is on the 28th, in fact 26th, 27th of September. That was when the ultimatum started counting. However, and at the end of that ultimatum, I report to the National Executive Council. I'll have to call the National Executive Council, hear from them what they think the way forward is. If they tell me, continue discussing with government, I will. If they tell me, no, we have to shut down until something is done, I have no other option than to shut down. Now, with respect to the 24-hour call limit,
how do we fix
that
it?
is starting, that is starting from 1st of October, from yesterday.
Okay.
We have told chief residents, center presidents across 91 centers across the country to monitor the situation. Any chief medical director or any assistant to a chief medical director or any head of department that wants a doctor to continue taking calls in these conditions, probably wants the death of that doctor. We've had cases of doctors who have died.
Dr. Rotifa in early September.
Early September. Very sad incidents. Young man, full of life, 3 days straight call, went to his room to rest, and he's no more. And we're here now talking about him as a statistic. You know, there are others like him too. What I expect from the federal government is one of 2 things.
Okay.
It's either we face what the reality is, we address some of these welfare challenges, we improve remuneration, we look at incentives, we improve the working condition, and then we move on as a country from that, or we continue to remain here. Now, laudable things are going on. New hospitals are springing up, free CS, free programs, free dialysis, all those things are excellent. I mean, I'm a doctor. I'm very proud that my country is giving out such things. But the manpower to handle it is entirely being neglected. And the association is now saying enough is enough. Let me tell you, if you increase the salary of doctors today, this is just hyperbole. It's not hyperbole, it's reality. By 100%, see, I know doctors that are in the Middle East, that are in the UK, that will jump back at the opportunity to return home. Let me give you an instance. If you leave the shores of this country, your work hour in a week will probably be just like 48 hours. In a whole week, 48 hours. Residents, I am in internal medicine. You work an average, together with your calls, an average of 100 6 or 7 hours in a week. If you're in the surgical fields, you probably work 122, 23 hours a week. That is equivalent to 4, 5, 6 days straight call in that week. Now, out there, in other shores, if you go beyond 48 hours, your supervisor has to explain why he gave you that extension. It's either you're compensated for the extra work, or you are given days of rest equivalent to the extra work that you have done. In Nigeria, that is not the case. You know, this is what we are saying, telling the government, bring to the table for conversations so that we'll find a way forward. The association is willing to talk.
You know, I'm
is.
looking at an interesting breakdown that the Vanguard newspapers actually did here, you know, saying doctors in Nigeria earn 2 million naira. Jackpot counterparts in the UK earn 50 million. I hope this will not cause some kind of revolution in the medical sector in Nigeria. Doctors in training in the UK, they get over 50 million naira annually. Residents in the US, nearly 90 million annually. And on and on and on. In Australia, they get 85 million to 120 million annually. I mean, this is really, it is really bad. Tell us again what the government needs to do to bring back not just the jackpot doctors, you know, but to fix.
Can we afford 50 million naira,
no, nobody's asking for that, you know, but something that is realistic within our own, you know, our own peculiarities in Nigeria. And these challenges, please, I'd like to know, are they peculiar to the Nigeria's public health sector, public hospitals, or is it the same in the private, you know, hospitals?
Well, I can tell you for free that if the federal government, as a resident doctor that I am myself, I'm a senior registrar with internal medicine in FTH Katsina. If the federal government pays me 2 million, I'm not going anywhere. I can assure you the federal government does not pay any resident.
Yeah, saying you don't earn 2 million naira, doctor.
I am very sure of it.
Okay.
In fact, after this, let me have your phone number. I'll send you my case slip so that you confirm every month I don't go home with 2 million naira. I think it's a straight graph. Pay rise, incentives. These incentives, we're not talking about too much. Housing schemes. And these housing schemes, they pay for themselves at the end of it. Right. Car loans, health insurance cover. I mean, the one we have now has a lot of issues, but health insurance cover. You know, that pay rise I'm talking about. A few weeks ago, someone came out from the Revenue Mobilization and Fiscal Allocation Commission and said 114% increment in salaries for political appointees within a matter of 2-3 days, and then it was done. You know, for doctors, I think for a lot of years, the Salaries and Wages Commission just announced a 1.7% increment for doctors in Nigeria for the meager amount we're earning. So pay rise, I don't want to mention 500%, 300% so that the media will not carry it. But let's start from somewhere fair in the country. We are currently discussing. There's something the federal government has called collective bargaining agreement. Right. That is supposed to review salaries and allowances of not just doctors, but the entire health workers. That is stalled now. You know why? Because the Federal Ministry of Health has refused to give the Salaries and Wages Commission a clarification on one particular allowance called call duty. The Federal Ministry of Health gave communication to the Salaries and Wages Commission years back that doctors, pharmacists, and others should earn the same salary.
Dr. Mukhtar.
Now give that clarification. They have decided not to, and is stalling that process of salary review.
Dr. Mukhtar, my producer is going to break my head, but the most important question for Nigerians tonight is how does this affect them that you have cut your working hours? What does this mean for patients? Very quickly in 20 seconds.
Well, maybe a long line of patients.
There are moral questions here. There may even be legal questions here. There are certainly ethical questions here. But I would prefer Nigerians be consulted by doctors who are fresh off of sleep, who are rested, who are well remunerated, who are well compensated for the work done.
Very well put, Dr. Mohammed Suleiman, President of NARD, National Association of Resident Doctors in Nigeria. Thank you so much for joining us. And we hope that government does the needful sooner than later.